Long-acting injectable or LAI prevention and treatment options have the potential to drastically impact access to HIV prevention and treatment strategies by reducing the burden of daily medication, improving adherence, and helping many people living with and at risk for HIV lead healthier and more empowered lives. Across Ontario, healthcare organizations, clinics, pharmacists, nurses, and community leaders are working together to make LAI accessible, status neutral, culturally safe, and stigma-free. Welcome to Positive News. My name's Aaron Clarke, and I'm your host for today. In this episode, we speak with management, nurses, and pharmacists across Ontario who will share their experience and best practices in bringing client-centered, status-neutral, and stigma-free LAI. We will be joined by a panel of 3 speakers. Arnold is the Director of Pharmacy and Operations and Clinic Services with the PrEP Clinic in Toronto. Nikki is an infectious diseases clinical lead at Module G Ambulatory Care in the Ottawa Hospital. And Deborah is a clinical pharmacy practitioner at St. Michael's Positive Care Clinic, Infectious Diseases and HIV in Toronto. Thank you so much for joining us. We'd first like to go around and have everyone share their insights on best practices that you would like to share with other organizations about accessing stigma-free services around LAIs.
So I work at a hospital-based ambulatory clinic in downtown Toronto. And I think what I've really learned is that we shouldn't make assumptions who wants it, who doesn't want it. Oh, this individual only takes 1 medication, so this would just, be so much easier. Or this person has 10 medications. What's another pill? We just don't know the reasons why an individual may select this. Also, I think would be a great role for community health organizations is just making people aware that this type of modality of treatment is even available. And if people are not aware of this, then they can't really ask about it. I think community pharmacy is great for PrEP, having something there to say, hey, have you heard about injectable therapy for HIV prevention or HIV treatment? I'm just surprised even when I speak to people in the clinic, hey, would you be interested in injectable? Have you heard about it? And they'd be like, no. So unless I had said something, then they wouldn't know that this even exists, and then they can evaluate whether this is something that they would wish to pursue. So I think all the, obviously the AIDS organizations are great in trying to promote that information, but people are accessing care in different ways, and from a pharmacist's point of view, I think a community pharmacy is also a great place to put out that information that this is available and ask for more information about it.
Yeah, I agree with you. I think that information is amazing, but that information actually has to land in the hands of people who need it, right? So community organizations definitely play a huge part in making sure that that vital information gets to the people who need it most. My second question, and we'll start with Nikki this time. What might AIDS service organizations and community health organizations, what roles might they play in contributing to accessible, culturally responsive information and support related to LAIs?
I work at the Ottawa Hospital in an ambulatory care setting. And so what we do in Ottawa is that we use a community and peer-based model, which helps address those structural barriers with accessing these injectables. We partner up with Bayshore Home Health Nursing and AIDS service organizations. All this is possible thanks to the strong partnership and communication with ACO. And so the benefits of having this is that we, as the specialists at the Ottawa Hospital, are able to guide patients and talk to them into whether or not they want to proceed with injectables. And then later on, they're sent to the community, to ACO, to get these injectables. And so the benefits of this is accessibility. They can feel a sense of community belonging when they access the AIDS service organization for the injectables, and benefit from the support services that the peer support workers have. And so the peer support workers, in addition, have language support to translate any care that the nursing provides. They have way more flexible hours than the traditional 9 to 5 that the hospital offers in ambulatory care. And most importantly, they have peers who can speak to them on that personal level. And of course, they don't need to come to the hospital every 2 months, which is a plus. In addition to the peer model, we also have the community model where nurses from Bayshore Home Health can go to the patient's homes, or they can get the injections from their local pharmacy. So there's many choices for people, and it's not just a one-fits-all image. In terms of addressing the population that the Ottawa region is having trouble with, the folks who may be living in precarious situations or using substances, there's opportunity to partner up with shelters.
Similarly, we face the same challenges in engagement has to be sort of established, and it doesn't have to necessarily be with us at our clinic. If it's with another provider or an organization, then we can partner together to try to deliver the injectable and also let this be an option for them. So definitely, if their community health organizations can connect us, that's, I think, an opportunity for treatment with the long-actings as well.
Next, we're going to talk about access. And I was wondering if you could share any challenges or successes that you've heard around access to LAIs.
Long-acting injectable is an option, and I think we're at a specialty kind of setting where, we're a clinic and a pharmacy at the same time. So there's really a lot of interprofessional communication happening between nurse practitioners who provide the assessments, our nurses that provide the lab work services, and our pharmacists that provide the counseling and the navigation in terms of payment supports. And I think it's really important that we factor that in, that, we find them the necessary financial supports to make sure that this is accessible. So our team is really on top of that to make sure that it's an ongoing therapy that is available to them. And in terms of overcoming stigma, and what we find is that, why do people generally switch to long-acting injectable? One of the reasons being some community members that we encounter are looking for, a bit more discretion as opposed to having bottles of medication at home. It makes it like an easier option.
HIV treatment has allowed people living with HIV to live long and healthy lives. And now it sounds like with the addition of LAIs, now it allows them also to enjoy their lives a little more without having that burden of remembering to take medication and that reminder every day that they are living with HIV. Of course, people are still living with HIV, but it gives, like we've said, it gives them more freedom that they didn't have prior to this intervention.
That has definitely been a success for several patients that had where there was just challenges in trying to maintain that tablet every single day. So it's definitely made a big difference for some individuals.
Yeah, for sure. I mean, I have been living with HIV for over 10 years now, and I still forget to take my pills sometimes. I mean, it's something that's so ingrained in my routine, and yet adherence is still a challenge sometimes. It's great that we have another option out there.
While as providers, we think about it as, adherence and compliance, if we really look at the individual person, that's a few minutes that they're gaining back every single day. And, that really adds up, and it provides them with a sense of reassurance that, this is the direction that we're heading in terms of treatment. And I think as a human being, you kind of feel a bit more optimism that people are out there looking out for you to make sure that these things are, constantly in development, as we approach a cure.
And I mean, these treatments only work well if they are used properly, and missing doses is not using it properly. So LAIs just allow you to use the medication in a more easy way. I would like to thank all of our panelists, and as they mentioned in their interviews, long-acting injectables, or LAIs, are helping people living with HIV access HIV treatment in a stigma-free and accessible manner. They underscore the importance of inclusive, stigma-free, and status-neutral approaches to providing LAIs. I'm Aaron Clarke, and this has been Positive News. Thank you so much for watching, and we'll see you next time.